Pushing for action on health care reform. The president spoke at a town hall meeting in Green Bay, Wisconsin. That was yesterday. We want to show you some live pictures right now because we've been telling you that the House is set to vote on, sweeping changes on a bill giving the Food and Drug Administration really unprecedented controls over the tobacco industry. We're talking about major new rules here. The vote is going on right now. We will get you the final results. It is expected to pass, and the bill is expected to get to the president's desk for his signature later today. Let's get back to health care now. You know, the reforms backed by the president and some Democrats call for a government-funded health care option, but that idea is running into opposition from the American Medical Association. Senior medical correspondent Elizabeth Cohen is back with us to talk more about it. What, 250,000 doctors or so are in the AMA, represented by the AMA? Here's what I want to know, Elizabeth. What is it that the AMA is saying? Why is this group opposed to the Obama plan as it's just being outlined right now?
Okay, let me put it in their words.
Okay.
All right, this is from a letter that the American Medical Association wrote to Congress last month. And what they said was the AMA does not believe that creating a public health insurance option is the best way to expand health insurance coverage and lower costs across the healthcare system. So the AMA knows that we need healthcare reform.
Right.
I mean, everyone knows it. And so what they say needs to happen is that there need to be reforms to the private health insurance
So make that system better?
Make that system better. And they say try doing that to ensure the 46 million who are uninsured as we speak.
And when we hear... I want to follow up on that, but when we hear the AMA is suggesting that they have real concerns about the cost-cutting measures, right, the efficiencies in a government plan, aren't they really saying that we have concerns that we won't make as much money in a government plan?
Let me put it in their
words
again.
All right, that's me saying
it.
Okay,
that's you saying it. Let me put it in their words again, because
Yes.
they've actually been straightforward. The AMA has been straightforward about what they don't like about this public health insurance option. They have several objections, but here are two of the biggies. They say that they don't want to be reimbursed at low Medicare rates.
Yeah.
They're concerned that a public health option would reimburse at Medicare rates. Medicare is reimbursing doctors at the rates that they made in 2001. All
Wow.
right, so it hasn't expanded. Also, the AMA does not want doctors to be required to participate. They don't want the government to say to doctors, you have to care for patients in this public
is the
health
president
option
saying
or
that?
else. Well, what's interesting is he isn't.
Right.
So it's not entirely clear to me why they think that they would be required to participate. I don't know why they think that someone's going to put a gun to their head and say, Dr. Harris, you got to do it or you're going to jail.
Isn't the real issue here that the doctors are just so concerned about malpractice insurance and they want real tort reform, and because there is so much concern over malpractice, that doctors are part of the problem in the system by ordering tests that aren't necessary because they want to protect themselves against the possibility that they could be sued. And that is part of the cost overrun that's built into this system right now. Am I right or wrong
Many
here?
people would say that that's
Okay.
true, that too many doctors are doing too many expensive procedures that they don't need to do. But let's get back to your
Sure,
first question,
sure.
that doctors don't like this plan because it means they'll make less money.
Yes.
Would you want to make what you made in 2001?
No.
No. There you go. There's not much more to say, is there? I mean, they don't like that. They're afraid that this public health insurance option is going to bring their salaries down to 2001 rates. That's the concern. Among other concerns, that's a concern.
Boy, this should be interesting on Monday.
Oh, on Monday. I wish I could be a fly on the wall.
Yeah, exactly. Well, you can watch it right
That's
here.
right, I
Elizabeth.
can.
Have a great weekend. Thank you.
Thanks.